Hello, my name is Jennifer Carless. Today I am in Pakistan and I'm at the Cleft Hospital, one of the only cleft hospitals in the world. Now I want to give you the opportunity to explore with me around the hospital and its settings outside as well. Come on, let's go. As you can see, we've got animals in the cages that children and parents can go and visit here. And we've also got a play area here as well, which the children can go and play at before operations and also after operations. Here is one unique thing to this hospital, and one that is one of the first hospitals to have this, is a garden, a wasp garden. This is basically aimed to bring nature to the hospital. Now I've shown you a little bit outside, let's go inside, meet some of the team and the procedure of how it all works at the hospital. Let's go. There's a lot of seats where patients can come and sit before they speak to some of the medical professionals here at the hospital. So now I'm in the main part of the hospital. I've got the opportunity to speak to Dr. Hill. He is a consultant plastic surgeon, one of the best in Northern Ireland. He works here with the Cleft team at the Cleft Hospital in Pakistan. So let's go and speak to him about how he works with the patients to correct them with the deformities. Hi Mr. Hill, lovely to meet you. Thank you for spending the time to speak with me this afternoon. How are you?
It's a pleasure, I'm very well, thank you.
Great, so let's start off by giving me a bit of context behind what you do as your surgeon role.
Well, I am a consultant plastic surgeon and I'm the cleft surgeon for Northern Ireland. I've been coming to the Cleft Hospital in Gujrat for the last 10 years, excluding obviously during COVID. I work here as part of a multidisciplinary team, delivering the full spectrum of cleft care. The surgery is only one part. And I've worked with some of the local surgeons here who have excellent skills. In addition to that, the hospital offers nutritionists, audiology and ENT input, orthodontics and dental care, and really can deliver the whole spectrum from birth right up to adulthood of cleft care, which is how cleft care is delivered in the UK, and I believe this hospital is one of the very few, if not the only hospital in Pakistan that can offer the multidisciplinary approach to cleft care, which is essential if one is going to achieve a good outcome.
Definitely, I've been lucky to interview most of the multidisciplinary team and it is amazing to see the work that goes on behind the team. So this seems like a very long process. So what can you say to someone that maybe has a child with a deformity but is very nervous about coming and getting help? What would you say about that?
Well, I would say that this facility offers, is probably the only to offer the full spectrum of care. And to achieve a good result for their child in terms of appearance, speech and the dental outcome, then the multidisciplinary approach is required. It's not simply a case of having the surgery to correct the deformity without the other pieces of the puzzle. It would be like doing a jigsaw with one piece. And I would encourage parents who maybe has a cleft to seek the proper advice and care, and I certainly believe that that is delivered in this hospital.
Definitely. Well, thank you so much for letting me speak to you today. It's been a true honour and thank you so much again. So now I've got the opportunity to speak to one of the best theatre nurses in the world, and she comes from Northern Ireland. Hello, how are you?
I'm very good.
The hospital is working at international standards. So tell me a little bit about that and how you said you were going to implement change, how you were working to do that within the hospital facilities.
So the hospital has a great standard of care, and I'm working alongside other practitioners to standardise sets, to teach and train the theatre staff that they have at the minute new techniques and rules, so that they can further enhance their skills and knowledge within the cleft department.
I think for me, whilst I have been here and interviewing people, it's really the quality of care that really makes it unique, this hospital. And I think having people such as yourselves, very experienced, very knowledgeable, to come to the hospital and help train the local surgeons as well is invaluable. So thank you so much for your time and speaking with me. And I'm really privileged to have the opportunity. Thank you. Now we're going to see one of the Doctor of Nutrition and speak about her important role within the Hospital of the Cleft Patients Care. Let's go. Thank you for taking the time to speak with me today. So, to start off with, tell me a little bit about your role here at the hospital.
Hi, I am fine, and I'm working here from last 1 year, basically dealing cleft care patients, and most of the time mothers are very worried about their child feeding and weaning guidelines, and I'm here to show them proper feeding and weaning guidelines about their child needs. That is basically our requirements to feed the child for lip and palate surgery, and that is mostly our main concern.
So yes, I think that's very important for parents to feel at ease when they come and speak to you. So thank you so much for your time today, and I hope this has helped some of the viewers at home understand the vital work that you do here at the hospital. I'm now here as part of the Clinical and Research Laboratory here at the Pakistan Cleft Hospital. So I'm going to speak to one of the research scientists here and find out more about their role and what they do as part of the Cleft team. Let's go. Hi, how are you?
I'm fine, how are you?
I'm good, thank you. So thank you for spending the time to speak with me today. So to start off with, tell me a little bit about what you're doing here.
So we were just collecting some samples so that we can run some tests for the patients, and before they are sent for operation, we need to check if they are eligible for the operation.
Okay, so tell me how clinical laboratory and research comes into play when talking about cleft palate and lip.
So Cleft Hospital is actually not just a simple hospital, it is actually a research institute, and we are striving to make it the best research institute in Pakistan and around the world regarding cleft research. So what we are trying to do now is we are taking blood samples so that we can do DNA extraction. For that we are also collaborating with different organizations here in Pakistan and international organizations like Mount Sinai, New York. So we have done some work with them. We are also looking for different grant opportunities so that we can work for in-depth genetic studies in the future.
So now we are entering the integral part of the Cleft Hospital in Pakistan, which is the dentistry area. So this is needed for patients after they've had their cleft operations to correct any deformities with their teeth. So let's go and have a look at the facilities here. So as you can see, it's very spacious, clean, and very sterile environment. So patients don't have to worry about what it's going to be like when they undergo these procedures to help correct their deformities. So they've got lots of different things in here, such as moulds from past cleft lip and palate patients, so then they can correct the deformities that were there. The whole room is very friendly and inviting as much as possible, and you can see the patient and the staff working together to make a difference to that patient. And they seem very comfortable and relaxed, which is what we need in a setup like this. Now I'm here at the Speech and Audiology department, where I'm going to speak to an audiologist about the work that they do for cleft lip and palate patients. Let's go. Hi, lovely to meet you.
Hi, nice to meet you.
So now I'm with the audiologist here at the hospital. So thank you for spending some time with me today. Let's start by telling a bit about yourself and what you do here.
My name is Smee. I'm an audiologist, a paediatric audiologist from the UK, and my role at the hospital at the moment is to help establish the audiology service.
So why is audiology important with cleft patients?
So all children are prone to having something called glue ear, which is basically where you end up with a build-up of fluid behind your eardrums. Children with cleft palate, due to the structural abnormalities of the eustachian tube, a tube that lies behind the nose and the throat, they are more prone to developing glue ear, which is a build-up of sticky mucus behind the eardrum. This can then in turn result in hearing loss at different intensity levels, different severity rather, and as a result of that it can impact upon their speech development. So it's really important to regularly monitor the hearing in children with cleft palate so that we are able to intervene if needed.
So what are the types of things that you do whilst you have a consultation with a patient? Just so some of the viewers can understand exactly what they will do when they bring their child.
Just take a bit of a case history, get an understanding as to what the parents' thoughts and feelings are about the child's hearing, have a bit of a chat about speech development, academic attainment, things like that. We then proceed to have a look inside the ears, do something using this machine which is called tympanometry, and that checks the status of the middle ear, lets us see if there is that glue ear there, and then we will test the hearing using headphones. With children we tend to make it quite fun, make it into a bit of a fun game for them, so there's a few different things that we can use. We have also recently brought a new piece of kit from the UK as well, which is more of an objective test, so the child doesn't really have to do anything, but it does still give us some information about their hearing levels.
Brilliant, thank you so much. It seems that you do very important work here for the hospital. Thank you again.